Hi, this is Dr. Meyer coming from San Francisco, and I wanted to introduce you to one of my new patients, Aileen. Actually, she's not so new, but I wanted to ask her to share with you a little bit about her experience. So, Aileen, first of all, thank you for being willing to do this. And secondly, can you just tell us what was the reason that you decided to try our care in the first place?
Well, at first, I didn't have any idea about any chiropractic practice,
Right.
and I've heard a lot of comments about it, that people are scared because they hear like cracking sounds
Yep.
when they do like the adjustments. And so when they went to our health fair, they have a lot of information, and they also did the checking of the spinal column, which is very interesting. And I think that in the long run, it would be more helpful to go to a chiropractor than to a doctor, because chiropractor seems to be like a natural way of healing yourself than taking any other medicines or chemicals into your body.
Fantastic. So what are the things that you noticed? You know, when we started out, are there things that you could say, like your energy level, or even though I don't like to focus too much on pain, were there areas that, you know, you would say that you had discomfort in?
Well, I've been like very optimistic about my health since I started.
That's
like
great.
I'm looking forward to like getting the new results that I'm gonna see like in the next month, that I'm getting better, and my spinal column is okay, and my health is getting better, my cholesterol, my blood pressure is okay.
Okay, so let's talk about a couple of things. We've worked not only with adjusting, right, so that we know that the movement and the positioning of the bones of your spine are really doing well. We've been doing fantastically with those. We also have talked about exercise, right? We've gotten you
Yes.
doing some exercises.
Yes, we
Okay.
have like neck exercises and the exercise ball, and I think that's really helpful because I didn't really exercise before, and it's like my first time to like adjust. But I think it's really helpful because I think right now I can do more stairs than I can do before,
Right.
and it's like a motivation for me to like really exercise.
Did we get you from being a person who pretty much did, you know, took the escalator and, you know,
Yeah.
rode it the whole way up to now you're taking the stairs
Yeah,
and multiple?
it's like never a question whether to do the escalator or elevator. It's more like do the stairs.
Okay. And we even, you know, just not to leave anything out, we even did wind up, you know, you had some trouble with your knees.
Yeah.
And it's getting better, you know,
Yeah.
taking care of everything. We're looking at supplements we're doing also
Yeah.
to help with the joints.
Yeah.
Okay. And then diet. You feel like we've made some good recommendations for changing and improving?
Well, Dr. Harris recommended the veggie juice, which I think is really good, and the garlic intake, which I think is also like a supplement to the to the veggie juice that
Right.
he recommended.
Okay, so you feel like we've gotten you to a place where your diet today, is it going to serve you better in 10 years from now?
Most definitely, yes.
You think you have a lower risk of things like diabetes and
Yes.
heart disease and cancer?
Yes.
Fantastic. Is there anything else that you would say to anyone who is just considering, you know, hey, I want to find a chiropractor, or I want to try and take care of my health a little bit better? Is there anything you would say to them to help them, you know, decide if we would be a good place for that?
Well, I would really recommend Dr. Harris' Body Focus, because I know that he knows a lot of stuff. Like every time we go here, we learn like what percentage of people like die from this chemical, and it makes us like think, oh, we shouldn't do like medicines anymore. We should like just exercise and like adjust our diet and our lifestyle, and it would like really help like the overall body health.
And we're going on a few months of care now with you,
Yes.
so you can honestly say that, hey, you're living this and you're feeling the benefit, right?
Yes.
I just want to do one last thing here. Your mom is also a patient,
Yes.
right? And we're not going to put her on camera. We're not
Yes.
going to ask her any questions directly. But can you honestly say that her health is better than it was before starting care here?
Yes, her health is better, like especially like her stomach problems. Since we took the not prescribed, but the recommended vitamins, the HCl.
Some
her
dietary
stomach,
changes too?
Yeah.
Okay.
And the veggie juice too, and the garlic and the exercise, I think really pump her energy. So,
Okay.
unlike before that, yeah.
Okay. And she gets adjusted also, and there's
Yes.
probably more joint comfort today and
Yes.
better range of motion, better mobility.
Yes, her back doesn't hurt as much as before.
Great, because we don't want anybody being in pain. We just don't want to be focused on the
Yeah.
symptoms entirely. And the last thing I want to say is, I know that your dad, who I've never met, is also sort of going through some of the same dietary changes that you guys are.
Yes.
And you just shared with me. Tell me what you told me. Tell them what you told me.
Well, before, it used to be that me and my mom leads us, like when we walk to BART, it's always us leading. But now it's my dad that's leading us to the BART. So that's really a good change.
So he's got more vigor, he's got
Yeah.
more energy, he seems more healthy
Yes.
to you?
Yes.
That's fantastic. Aileen, thank you so much for sharing. I greatly appreciate it. And I'm so happy to have you as a patient.
Thank you, and you're welcome.
All right, thank you.